So the last session of this part is on chronic diseases, Sura. Secondary Sura, of course. Secondary Sura. And today we have chosen the first part we have already covered, that is head, neck, face and throat last time. And next part we will cover is extremities, generalities and skin. And this part 2 today is thorax, abdomen and pelvis. Now remember, in chronic disease, this Sura, secondary Sura has been described, but all symptoms are given continuously and they are arranged mostly in that manner, but headings have not been given. For our ease of understanding, we have organized them under heading and tried to retain the main structure as it is. Under thorax, there are 35 symptoms enlisted as head of respiration, cough, inner chest and lungs, heart, pulse and circulation, neck and back. We shall take a quick recap of this and afterwards you are required to read it from the main book again. Now here it is asthma merely when moving the arms, not while walking. That means that this particular local symptom is there. Then big one, attacks of suffocation, especially after midnight. Patient has to sit up, sometimes he has to leave his bed, stand stooping forward, leaning on his hands. He has to open the windows, that is air hunger, or go to open air, etc. He has palpitations. Then these are followed by eructations or yawning, and the spasm terminates with or without coughing and expectoration. Then asthma, symptoms of shortness of breath, symptoms of asthma again on moving with or without cough. Then asthma again mostly while sitting down. Then asthma spasmodic when she comes into open air and it takes her breath. Asthma in attacks lasting several weeks. So this is about respiration. Then cough symptoms are many. Cough, frequent irritation and crawling in throat, which does not abate until there is retching, that is vomiting effort, hard effort to vomit is retching, which terminates every time with sneezing, mostly in the evening after lying down or whenever head lies low, has to raise the head, waking the patient up after first brief sleep, that is sleep disturbed, especially in night, worse after eating in the morning, worst after eating at once with every deep breath. Then cough causing sensation of soreness in chest, then dry cough, then that is cough with yellow expectoration. Here suppurative pulmonary phthisis, that is tuberculosis, has probably seldom any other cause than this malady, even when it seems as if fumes of quicksilver, that is mercury, or arsenic has caused it. At least most of these cases of suppurative phthisis originate in pneumonias mismanaged with bloodletting, and this disease may always be considered as manifestation of latent Sura. Now this background of phthisis you have to keep on one side and you have to see its application in the present scenario. Then cough with excessive expectoration of mucus and sinking of strength. Then attacks of whooping cough. She is suddenly compelled to cough but cannot do so as her breath fails her, even to suffocation, with a dark red bloated face. Usually the esophagus is then also constricted so that not a drop of water will pass. So there is constriction in throat, and after 8 to 10 minutes there follow eructations from stomach and the spasm terminates. So this is a picture of whooping cough, and whooping cough is described as a fixed disease, but then here there is a recurrent condition like whooping cough, attacks of condition like whooping cough. Then we come to inner chest and lungs, violent at times, unbearable stitches in the chest at every breath. Then we find pain in chest on walking, symptoms of pressive pain in chest. You can read often a slightly constrictive pain in chest, which when it does not quickly pass causes deepest dejection. Dejection is naturally sorrow, depression. Usually the attacks last from evening to morning, the whole night. So this enlisting that night aggravation is a syphilitic symptom, if we say that means that we are not considering what Hahnemann has said in Psora. Night aggravation is also soric. Burning pain in the chest, frequent stitches in the chest, violent stitches in the side, great heat of the body with hemoptysis and headache. He is confined to his bed. That is lung symptom, pulmonary symptoms. Then heart pulse and circulation, few symptoms: obstruction of the breath with stitching pains in the chest and slightest amount of walking. He cannot go a step farther. That is angina pectoris. Then especially when ascending a height, palpitation with anxiety, especially at night. Last under thorax is neck and back. In the small of back, that is the lower part, the small of back where there is a curvature. So in the back and in the nape of neck, drawing, that is tearing, tensive pain. Then lancinating like a sword, cutting, painful, stiffness of nape of neck on or the small of back, pressing pain between shoulder blades, sensation of pressure upon the shoulders. So these symptoms are psoric symptoms. Then we go to abdomen. Under abdomen we find a distinction, rather headings we have used, about 6 of them: appetite, eating, drinking, hiccup, scorbiculum and stomach, hypochondria and abdomen and loins. These headings have been taken from Hering's guiding symptoms, that is anatomical schema, Hahnemann's anatomical schema. Now appetite, frequent sensation of fasting and emptiness, ravenous hunger which is called canine hunger, then ravenous hunger with rumbling and grumbling in abdomen, appetite without hunger, that is has to eat. She has a desire to swallow down in haste various things without there being any craving therefrom in stomach. Then a sort of hunger, but when she when she eats ever so little, she feels at once satiated and full. Remember, this is the language of the patient described here. And this particular language has got to be interpreted, number one. And most important is because less medical terms have been used by Hahnemann, that is why it has not become outdated. Otherwise, if medical terms would have been used, then it would have become totally outdated. Then want of appetite, only a sort of gnawing, that is eating, turning and breathing of the stomach, as if stomach is giving trouble, urges her to eat. So much hunger, pain is there. Then now you can interpret this in duodenal ulcer. So that is your application of current medical knowledge, which you can apply. Then repugnance to cooked warm food, especially to boiled meat, and hardly any longing for anything but rye bread. Now rye bread is a bread in Western countries, and that is out of rye. Rye is what we call sarson here. So this is a foreign food. Here we don't eat rye bread, I think. But whatever we eat, we can substitute it, or for potatoes, and that is especially in youth and childhood. Then this particular normal food which one likes, there is an aversion to it. There has been a lot of fight on this symptom, that is aversion to meat. Aversion to meat, we have been taught, is a syphilitic symptom or a psoric symptom. So now aversion to meat is syphilitic, so they will call the persons who do not eat meat as syphilitic persons, and the persons who eat meat as psoric persons. And then there is other group who are vegetarians, they will call it aversion to meat is a psoric symptom and desire for meat is a syphilitic symptom. So somehow Psora syphilis psychosis has been generalized in this way, that all good symptoms are my symptoms and psoric symptoms, that is why I am psoric. And all bad symptoms are syphilitic and psychotic symptom of my enemies, and that is why they are all my enemies are syphilitic. Somehow there has been this classification, which I must tell you again. That one time I asked a question, that sir, you have described this is psoric, this is syphilitic, this is psychotic. So there are 3 classes. Everybody is divided into 3 classes. Is there not a person who is not having any psora, syphilis or psychosis? Then this is no. There is nobody who does not have Psora or syphilis or syphilis. You have to understand this. And by force you have to classify somebody as a syphilitic or psoric or syphotic. Is it, sir? There is one thing having no disease and another thing is having disease. So having disease is classification, and having no disease, being human being also as soon as you are born. So somehow there is so much of this prototype being induced that we forget that there are persons who are having no complaints, no miasms, and there are persons who are having miasms, and Hahnemann has said that 7/8 of them are having Psora, and today also a very large population is psoric. I repeat it again, which I have told you in the first class itself. Then when she wants to eat, she feels full in chest up to this we had said, ravenous hunger with rumbling and grumbling. Here this also is sort of hunger. Then symptoms of she wants to eat, she feels full up to 8, yes, repugnance, sorry, I am back to 9. In the morning at once thirst and then constant thirst. So these are symptoms of appetite, thirst and desires. After that we go to eating and drinking. Griping in the stomach, painful griping in the stomach, it suddenly constricts the stomach, the griping, especially after cold drinking, not infrequently with vomiting of mucus and water, without which in such a case the griping is not relieved. Pain in stomach as if sore when eating even the most harmless kinds of food. Then pressure in the stomach, this symptom of pressure in the stomach. Then from any particular dishes, fruit, green vegetables, food containing vinegar, etc. So all these things which are normally harmless things, so even those things are causing symptoms because of the fault in the stomach. That is acidity nowadays you call it. Now during eating feels dizzy and giddy, threatening to fall to one side. After the slightest supper, there is food, nocturnal heat in bed. Now this supper and dinner, these words are also differently understood in different parts of the globe, different parts of the country. We had been taught in the childhood that what you eat in the daytime is supper and what you eat in the night time is dinner. But then we see otherwise. We see that dinner being taken in the daytime and supper being taken in the night. It depends from area to area. So we have to see food, eating. After meals, anxiety and cold perspiration with anxiety. There may also be pains renewed now and then, that is stitches in the lips, distant parts, griping and digging in abdomen, pressure in chest, heaviness in back and small of back, even to nausea, when nothing but an artificially excited vomiting will give relief. That is, by vomiting there is relief. With some, the anguish is aggravated after eating, even to an impulse to destroy themselves by strangulation. So much frustration that wants to kill himself, so much disturbance. That is symptom here. During eating, then immediately after eating, after meals, pressure and burning in the stomach or in epigastrium, almost like heartburn, that is acidity. After eating, burning in esophagus from below upwards. Then after meals, distension of abdomen, with this at times weariness, that is weakness in arms and legs. Then after meals, very much tired and sleepy, often until patient lies down and sleeps as if intoxicated, headache, palpitation of the heart. And all this is after meals. Alleviation of many complaints from eating. So both opposite symptoms are there. There is aggravation also and there is relief also. This type of distinction will not be possible, that aggravation is this and amelioration is this. No, both things may be present there. The hiccup, belching, nausea and vomiting. Eructation with taste of food, eructations empty, loud, mere air, uncontrollable. Incomplete eructation, eructation sour, either fasting or after food. Then same eructations which excites to vomiting. Rancid, that is spoiled food. Putrid or mouldy, earth-like. Then frequent, there is bad smelling. Frequent eructations before meals. Heartburn is acidity, more or less frequently. Then water brash, means when water comes to mouth, a gushing discharge of sort of salivary fluid from the stomach. sort of saliva. Saliva cannot come from stomach, but sort of thin fluid is as if it is from stomach, preceded by writhing pain in the stomach. The pancreas. Now here the word pancreas is literal word and not the organic word, because to understand it is coming from pancreas, how do you know? It can be that area particularly, but then we know that dermatomes are different and organs are placed differently. A pain which is here on the left side may not necessarily be from the stomach itself, but patient's expression is there. This also at times turns into vomiting of water, mucus, or a gush of acrid acid, more frequently after eating flour dumplings, that is the dumplings, that is the flour is the food which is being taken, bread or flour, whatever you call it, vegetables causing flatulence, baked prunes, that is dry fruits. Then that is the food of that time. Today's food is different. In short, the food to which you are accustomed, then under this condition you cannot tolerate it. Ruling complaints means predominating complaints in any part of the body are excited after eating fresh fruit. That is aggravation from eating fruit, especially when it is acid, and also after acetic acid, this vinegar which is used in salads. Nausea early in morning are often coming very suddenly. Then even this nausea even to vomiting in the morning after rising from bed, decreasing from motion, gets reduced by movements. Then nausea always after eating fatty things or milk, vomiting of blood. Then hiccough after eating or drinking, swallowing preceded by spasms and spasmodic involuntary swallowing. So this complex we see about hiccough, etc. Then scorbiculum is the epigastrium. Then in the pit of stomach there is sensation of swelling, painful to touch, sensation of coldness in the pit of stomach. Then pressure in the stomach or pit of stomach as from a stone, or constricting pain which is cramp like, in some cases even after fasting, and causing him to wake up out of sleep at night, sometimes oppressing the breathing. So this is due to empty stomach. Then in the stomach, beating and pulsation even when fasting, spasm in the stomach, pain in the pit of stomach as if drawn together, usually a short time after eating. Then constricting pain in the epigastrium immediately under the ribs, that is this particular part. Then hypochondria, both hypochondria, one symptom only, pain in the hypochondria when touched and in motion, or also during rest. Then under abdomen and loins, that is the back of groins, the flatus does not pass off but moves about, causing many ailments of body and spirit. At times drawing pains in the limbs, especially in the lower limbs, or stitches in the pit of stomach or side of abdomen, etc. Incarcerated flatus is the word used, blocked flatus. Then abdomen is distended by flatus, abdomen feels full. Symptoms of flatus described in a great details here. Then sensation as if flatus is ascended, followed by eructations. Then in eyelid also these symptoms are called symptoms of bile. Bile means gas. And how do they interpret about gas? Many times these are these are symptoms of anxiety also. So any symptom, any pain which if relieved after eructation, then the patient thinks that there was a gas and that gas has come out. And here you have to remember even aerophagia. There are patients who will say, doctor, if I press here, there is eructation. And what they are doing, that they are swallowing air inside unconsciously, not intentionally. And when they press it, then that very air is discharged. So aero and phagia means eating air, and when air is eaten, then that is brought out. So these symptoms without any presence of organic conditions are the symptoms of anxiety also. Then cutting pains in abdomen as from obstructed flatus. Then we have got cutting pains in abdomen almost daily, especially with children, often in the morning. cutting pains in abdomen. So this all antisoric group of remedies will come in, and from among them you have to select. So that is the meaning of telling that it is secondary Psora, Hahnemann has said. Then in the abdomen, quamishness, a sensation of voidness, emptiness, disagreeable emptiness. Even immediately after eating, he felt as if he had not eaten anything. So that is voracious appetite, you call it. From small of back, around the abdomen, especially below the stomach, a sensation of constriction as if a bandage. After she had had no stool for several days, pain in liver, then a pressure and tension. Then here below the last ribs in the hypochondria, tension and pressure all over, pain in liver, inflammation of liver, then pressure in abdomen as from a stone, hardness of abdomen, crampy colic, then in colic coldness on one side of abdomen, a clucking, croaking and audible rumbling. So that is a rumbling sound, gurgling or grumbling. Nowadays we call it gurgling in abdomen. Then so-called uterine spasms in the lower abdomen, pain pressing down towards the genitals, coming down, inguinal hernias. Then inguinal hernias as a rule only from internal sura, excepting a few cases when these parts are injured by great external violence, or when hernia arises in superhuman exertions of body through lifting or pushing quickly while in a great height or while in a great fright, fear. Then swelling of the inguinal glands, which sometimes turn into suppuration. Then here abdomen and loins, finally cutting pains in the abdomen as if from obstructed flatus there is a constant sensation. Then cutting pains in abdomen, in the abdomen, quamishness or sensation of voidness. Then this particularly abdomen symptoms I think has come again, sorry. Pelvis we have described under stool and rectum, urinary conditions, male sexual organs, female sexual organs and pregnancy. Under these 5 heads, it's a quite big one. We'll take a little faster round of these things. Stool and rectum, constipation, stool hard as if burnt, small knots, stool of mere mucus, passage of round worms into and various symptoms of stool you see are present here, and you can read them. Stool and rectum symptoms, these I will just show these to you after stools. Then that means symptoms of constipation, symptoms of diarrhea. If it is diarrhea, then see the symptoms of diarrhea or constipation. Then painless and painful hemorrhoidal varices. Then bleeding hemorrhoidal varices. Fistula in ano have probably never any other cause than this remedy, forcefully says Hahnemann. Then with bloody, actually Hahnemann discovered Sura and Hahnemann described Sura, and after his description of Sura, the profession rejected him for his description because they said that everything Hahnemann says is Sura, and it was rejected. Subsequently, when after rejecting this, also when the cures were not taking place and those people who followed this could get the results, then the interest of the profession increased in Sura. So, alright, if you are a discoverer, if you are an owner, like if you have a great grandson, then for you the great grandson is everything on the earth, and everything centers around your great grandson. So that is what happens with a great grandfather. That is what it happens with scientists who discover something. That is what had happened with Freud when he discovered about the importance of sex, and the meaning of sex itself is changed, and he said everything is sex. Similarly, Hahnemann also said this too. It is for us to understand it, that how much importance to give to that. That does not mean that everything he says is not correct. If we think like that, then we are wrong. But being a discoverer, being somebody with whom you are very much attached, this thing is quite common. Remember this. Now after these stool and rectum symptoms, we go to urinary symptoms. During micturition, anxiety, as if at times prostration, too much urine is discharged, then painful retention of urine. When he is chilled, he cannot urinate. At times owing to gases, she cannot urinate. The urethra is constricted in parts, where he says in rare cases psychosis may be complicated with Psora. Then pressure in bladder, then he cannot hold the urine for any length of time. Then frequent micturition at night. Diabetes symptoms are there. Urine passes in sleep involuntarily, that is bedwetting. Then or in symptoms of enlarged prostate. After urinating, urine continues to drip out for a long time, dribbling, whitish urine, during urination burning, then urine of penetrating sharp smell, then urine quickly deposits a sediment, discharge turbid, dark yellow, then kidney grit is red sand. That is what is red sand in urine, you read in lycopodium. Then blackish urine, urine with black particles. After urinary symptoms, there are male sexual organs which you can read them. There are quite a few, and it depends on your interest in treating the patients, where these multiple symptoms of semen, prostatic fluid, nocturnal discharge, then the difficulties of erections, which are frequent, long continued, very painful, without pollutions also. Then semen not discharged, then accumulation of water in tunica vaginalis, that is hydrocele, never a complete erection, itching of scrotum, problems with testicles, and then all the symptoms have been enlisted. It's quite a big rubric, quite a big list here. Lack of sexual desire in both sexes, that is depression, and depression is Psora. So symptoms of Psora can indirectly be interpreted like this in simple terms. Then you see uncontrollable, insatiable lasciviousness, that is metromania and nymphomania. Metromania particularly was term used earlier, which was for females, and nymphomania for males, but now nymphomania is a common term being used. Excessive sexual desire is the other side, mania. Then sterility, impotence without any original organic defect in the sexual parts. So all these symptoms have been, and remember 200 years back the concept of sex and the concept of sex today, you have to accordingly adjust yourself. Female sexual organ symptoms are quite a few. Menstrual complaints, number of menstrual complaints, tardy as well as menses slow in setting after 15th year, that is delayed menses. Then here menses do not keep their regular periods. So these symptoms of menses you can go through in detail from there, or you can read it again. Then only one day after a few hours I am going to supply PDF to you, so in that PDF you can read it again, because if you read this audio visual, that will go with its own speed, you cannot read it in slow, but then you can stop that and read it, of course. The menses flow for 5, 6, 8 or more days, then menses flow too strongly. So all symptoms of menses are naturally going to be here, but again the antisoric remedies which you are to select and the mental picture which you are to select, so that arithmetics you are required to do. Now you will say, sir, you have given me dictionary, what do I do? Every word is there in the dictionary. So the dictionary is bound to contain every word, Joshi. Then leukorrhea from the vagina, then leukorrhea, malignant kind, all these symptoms of leukorrhea you can read it. Then finally the pregnancy, premature birth, during pregnancy multiple complaints, breast weakness, dwindling, then erysipelas, that is skin complaints, then heart enlarging and indurating gland with lancerating pains in one or both mammy. So this application you can make even in malignancies for that matter. Select remedies accordingly. itching, also moist and scaly eruptions. So that completes our description of second part of secondary sura.